So the patient story that I'm going to show you guys today actually came from one of our videos, and she found us through TikTok. So any of you guys can do this, but for online patients, we get their labs done, and she saw that video and she wanted to get hers done because of what's been going on. And she's a female that's in her 50s dealing with hot flashes, night sweats, fatigue, sciatica, varicose veins, acid reflux, some gallstones, frequent urination, hair loss, constant stress and anxiety. So we ran all of her hormones, we ran a full thyroid panel, and everything else to look at the entire body and see what was going on. So let's look at her labs and see what we found. So we ran some blood work on her, and right off the bat, right here, she's menopausal, keeping that in mind, but some of her estrogens are crazy low. So of course she's gonna feel hot flashes. She's gonna feel sluggish. Her adrenals are gonna be downregulated. Her progesterone, obviously very low as well, but her full thyroid panel. So we have positive thyroglobulin antibodies here. We have a reverse T3 that is way too high, up at 20. Now that's preventing, this reverse T3 is preventing actual T3 from doing its normal functions in the body. So that is one factor, mental stress, that is inhibiting all of our body's hormones from a thyroid perspective, and that works with your adrenals as well. Another big reason, her testosterone, up at 43, this is supposed to be converting down into the estrogens, which would prevent her from having low estrogens in the first place. But the hair loss that was tied into things here with her thyroid being flared up, this is why she was losing hair. This is why we have hot flashes. This is why her estrogens were so low, because her liver's not converting this down. And this was done at 2 p.m. and she's got a cortisol up at 16 almost. So stress is way too high. We're not converting hormones down, and now we know what to do. We ran additional markers too, seeing that ferritin's crazy low, cholesterol is cranked up as well as triglycerides, so no wonder her liver is slow, and we want to get these down. This shows us that we are inflamed, and just to back that up, CRP up at 4.3, holy cow. We want this less than 1. We want to be in low cardiac risk, not up above the third level here. Homocysteine, another liver issue connected to why she was holding on to all this testosterone. This is way too high. We have to give her support to get her body to adapt to these stressors and get back to normal. And vitamin D, crazy low here too. We need to bring this up, especially with a thyroid issue going on. Her immune system needs a boost. We need to have the resources in order to combat all this inflammation. And we check for sugar levels as well. So both A1C and insulin have gone way too high for way too long. Both these are very anabolic. Both these can contribute to a lot of the symptoms that she was feeling. So this woman is almost 60 years old, and it took her to almost being 60 to find a doctor that's gonna run all these things in her blood, find out what's going on and why it's happening, and how to get her body back to normal with a plan. What to do for food, what to put on and in her body, how to treat her body physically, and what to be doing supplementally to get these labs and help her body to adapt to all these stressors and have these ranges come back to normal, because you guys are not programmed to have low hormones. You're not programmed for disease. Menopause is just a stage in life. It's not a disease. You can have symptoms associated with it because you go all your life stressing out mentally, chemically, and physically, and now you have no hormone left when you're 50 or 60 years old, and it's not supposed to be that way. And actually, you can make a ton of change by focusing on your thyroid, on your hormones, and get all these symptoms to die down. So if this is something that you're struggling with, comment down below, comment help, hit our link in our bio, send us a DM, ask us questions, because we can help you guys out. Figure out what a plan is to get you back to normal. Dr. Antonio, see you guys next time.